Okay, so we're going over in the run-up to lunch to a series of talks which might be labelled practitioner, but in the very broadest sense, but sort of practical thoughts about how you do this activity of engaging people in data privacy. And our first speaker, who's going to connect to the exercises you just sent us, no doubt, is Malcolm Oswald. Over to you, Malcolm.
I just have a very quick bit of housekeeping announcement to make. Just to remind you all, as I mentioned yesterday, that the recorded talks where we have speakers' permission and the presentations will be made available. So I think some of the presentations we've had a lot of slides, so don't worry, we will be...
So I'm Malcolm Oswald, and I'm an Honour Research Fellow in Law at the University of Manchester, which really just means the university doesn't pay me. And I've recently set up a social enterprise called Citizens Juries Community Interest Company to design and run citizens juries, which is what I'm going to be talking about today. And thank you, all of you who were prepared to allow some invasion to your privacy and complete that survey. And I'll talk about that in a minute. The outline of my talk. We've begun just before the break asking you some questions about health and data privacy, and I'll come back to those questions. And I want to talk about a couple of citizens' juries that were run in Manchester in January on questions of health and data privacy. I'll begin by explaining what a citizens' jury is, what the two juries in Manchester did, who the people were, where they came from, what they concluded, and then a last bit on so what, does it matter? So, for those of you that completed the survey, that first question, which was about sharing data across government, and you were asked whether you would share all the data. We can, because it benefits the services of me. This is from an Opsis Mori survey of, I think, 1,500 people. And broadly speaking, your answers are not that dissimilar. I thought they might be more dissimilar given the subject of today. They're not that dissimilar from what people in the survey said in answer to this question. The second one, someone at the front rightly said, that looks a bit like care.data. And indeed, it's not unlike the care.data scenario. For those of you familiar with that, which was a government initiative to collect and use data from patient records around England for various purposes, which at the time weren't very well specified. And this question is one that we put to the juries soon after care.data. And again, your answers aren't so dissimilar to the ones I'll show you later that the juries came up with. The second one said, okay, so if we create this database, who should get access to it for what? And unfortunately, these are a bit to summarize. Let me just go down. So the first one was for NHS clinicians, and most people were kind of happy for them to do stuff about what health services should be funded. And you're least happy with F, which was using data for health insurance premiums. But in fact, a surprising number of you, to me, were okay with that. So there's a kind of, and these again were questions we put to the jury over the course of the citizens' jury, so I'll come back to these. So thank you everyone for taking part in that. It's partly just to help you understand what I'm going to be talking about later. So what is a citizens' jury? I'm going to show you a short video, which is from one of the two juries run in January. The most of it's about that, and then there's a little bit of a video at the end of some interviews with people in a post-jury workshop we held in March, where we got the jurors, or some of the jurors from those juries, plus people from national policy bodies, researchers and others, to come together for a workshop to reflect the results of the work of the juries and what it meant. So hopefully this will work. It did yesterday, but it does take a moment to load.
Citizen jury is a method of public deliberation that invites a small cross-section of citizens, residents, or community members to learn about a topic over the course of several days, to analyze the pros and cons of different proposals, and to generate and draft their own recommendations that are aimed at solving that problem.
Public authorities that have responsibility for looking after health records have difficult decisions to make. They have to decide how much they use those records for good things like research, improving public health, but they also have to make decisions about what kind of choices to give patients to control access to their records. Surveys tell us what people think, but citizens' juries give us more than that. We can bring in experts, the jurors can ask questions that become better informed about the policy problem and reach more informed decisions that can inform policy.
My opinion, that's definitely changed. Just because I've learned a lot more about what actually happened.
It's not just sitting and listening to people, speakers, it's, very participatory, lots of discussion, lots of time for breaks, for speaking to people. The groups have been mixed up as well, which has been good, so you're not hearing the same opinions all the time, you're meeting a different cross-section of people. It feels like I've been empowered to make a good decision based on the evidence, not on hearsay or gossip or what's written in the papers. It's more, these are the facts, this is what's real, how do you feel about that?
I'm very impressed by the work that's been done on citizens' juries to the University of Manchester.
What I would have been particularly impressed with is how transparent this process has been. I think it's very interesting to see that when people have the context explained to them and understand what safeguards are and what their rights are, they buy into the idea of patient information being shared for a greater public purpose.
Okay. So hopefully that helps answer that question about what is a citizens' jury. It's a form of deliberative democracy. Oh, sorry, I've got that upside down. It's a method that comes from an organization in the States called the Jefferson Center. So it was born in the USA about 40 years ago by a guy who did his PhD in this, and then he set up the Jefferson Center to design and run citizens' juries. And it's used in various places around the world. Australians seem to particularly like this method. So what did the two juries in Manchester do? So it was over 3 days. The juries were designed and run in conjunction with the Jefferson Center. And in fact, Kyle, the director of the Jefferson Center, who you saw, came over to run the juries. They were posed specific questions, and the two questions that you, the second and third question that in the questions that you were posed before the break, those were the questions that the jurors had. So a little bit like care.data, where he said, if we're going to create this database, should we be allowed to? Should people be able to opt in, opt out? And if it was created, who should get access to the records for what purpose? And there were 5 expert witnesses. I'll show you who they were later. There was time for deliberation, and at the end, people voted to reach conclusions. So 2 juries were run, so we kind of repeated the process, exactly the same process, same people, except the jurors were different. So we had 17 people in each. So we started with 18 in both juries, and after day 1, someone left in both juries for different reasons. They were broadly representative, so they were controlled in terms of age, gender, ethnicity, and educational attainment, in terms of relating back to the 2011 census. And we also used, because we didn't want it's quite a small number of people, and we were concerned that we didn't want to have a group of people who happened to be very pro-privacy or very pro-information sharing. The the question 0 that you answered, the very first question in that before the break, that question was posed and we knew the answers from the Ipsos Mori survey, so we could get broadly similar mix of people. So we recruited people from various places, and as an afterthought I put an advert on Indeed, the jobs website, and was getting about 40 people a day applying from there. So that was a very successful way of recruiting people. People were paid £400 for the 3 days, and that was an important thing as far as I was concerned. So I think work I've done over the years has often been about consulting patients, members of the public, and I think very often I've gone to groups, and what we're trying to get was people who perhaps don't particularly engage with this, never thought about it. Some of them wanted to do it because they thought it was an interesting idea, some of them wanted £400, and that was fine. So who else was involved? It was funded by the Healthy Research Council and another body with one of the longest acronyms I've ever seen. And the facilitators were Kyle and Amanda Hunn from the Health Research Authority. Those were the expert witnesses. Some of you may know of some of those people. So there were 2 witnesses who were meant to be entirely impartial. The first 2 trying to give information about patient records and the law, and then Soren, a bioethicist, giving ethical arguments, pulling in both directions, and then sort of arguments for and against by 2 different speakers. And the project was designed and project managed by me, working with the Jefferson Centre. So what did the jurors conclude? So quite hard to sort of grasp this quickly, so I'll just talk you through some of the main points. Does the pointer work here? Do you know the pointer?
I think it's that one there. Yeah,
okay, thanks. So the empty circles are pre-jury answers to the questions. So we surveyed people on the questions they were going to, just like we surveyed you, we surveyed people before and after, and then the filled-in blobs are their answers after the jury, so we could see how people changed their mind. And in the first jury, there was quite a strong move towards an opt-out system, less clear, and in fact, you could say that people went slightly towards opt-in on the second jury. In terms of what people thought of the questions about who should get access, there was some movement, particularly in the first jury that we ran, towards people became more comfortable as they understood more. But interestingly, where they began, I think people were perhaps a little bit more sceptical than this audience on where they began before the start of the jury. But you can kind of see there's quite a strong trend, particularly in jury 1, slightly less in jury 2, towards perhaps as people understood a little bit more why people wanted the data, they might become more comfortable about sharing data when they understood the reasons. They also, it wasn't just about voting on these initial questions. They gave reasons for their questions, and these are some of the reasons they came up with, and they prioritized these. They kind of ranked which were the most important, and I'll let you read these for themselves, but these are reasons about which organization should get access. And I think there's some pretty important reasons that they've picked out there. This is the things that people said about the experience of being on the jury afterwards. In fact, this was taken for some juries run in November, so last month. We didn't ask them to give their one-word descriptions in the ones in January. So people quite often change their minds. So on this question about sharing across government, that's how people started on the first jury. So after the first, so 7 people basically didn't change their mind through the course, and 10 people did, and those 10 people all moved in the same direction. So a colleague of mine did this slide, and to me this is like the best bit of my presentation. So I'm going to have to show you that again. It's like, to me, it's like the goals on Match of the Day. So 7 people didn't change their mind, 10 did, and they all moved that way. On the second jury, this time 9 people changed their minds, and 2 people moved to the right and 7 to the left. So not everybody moved in the same direction. And I'm just been given a 5-minute warning, so I'm not going to show you that one again, much as I'd love to. So what? Well, it was a very small sample of people. It's 2 lots of 17 people. It's not perfectly representative. You cannot get a perfectly representative group when you're talking about such small numbers. There's a very important critique of citizens' juries. There's a potential for bias, both conscious and unconscious, and psychologists will tell us that there are many different unconscious biases which we all suffer from. So it's very hard to eliminate these, if not impossible. And I think from myself, from my own experience trying to do this, I realize that it's very difficult. There's so many little choices that could be subject to bias. So when I review the slides from the expert witnesses, each bullet point on a slide of an expert witness could be inducing some kind of bias. So what we tried to do was monitor, minimize, and publish stuff about that. So we had an oversight panel of 3 people who reviewed the materials that the jurors saw. We gave questionnaires to the jurors which to ask them about bias. And there were some small levels of bias, so something of the order of 1 or 2 people on the jury thought there was some bias throughout the process of 3 days. It's important that you separate the people funding it from the process of designing it. So they must set the questions, but you don't want them to interfere with the process, because they may well have an agenda that they want a particular answer from your jury. The jurors essentially developed the reports through the process, and those were published. And on the website, which I'll show you later, pretty much everything that moved on the project, we published it. So what? So one thing I think juries can do is they can increase legitimacy of public decisions. So the law might tell us what to do and what not to do, but I think there are many normative policy decisions that public bodies make. And I think we can rely on evidence and values. And things like citizens' juries can inform and provide a basis for the decisions made by public bodies. They can tell us something a little bit different, so surveys matter, and you know the things that Lizzie was talking about is very different kinds of techniques where you're kind of going out and deliberately looking to hard-to-reach groups and getting their views. So I think there's a space for a lot of different methods. But policy is complex. Most policy questions I've ever understood, I think I understand, it's taken quite a lot of time to get into them to understand them. The more I find out, the more I realize there is to know. And I think citizen juries can tell us a little bit more about what people think when they better understand the question. And they have a chance to talk to others. And what we find is people often change their mind. So a couple of quick things. So Melbourne City Council, they ran a series of juries. They had a $5 billion budget, which is about $2.5 billion pounds, and of 10 years how to prioritize their spending. And they ran a series of juries, or similar things to juries, and they came up with about 16 recommendations, I think, and the council went with about 13 of them. You may have heard that at the moment in Ireland they have a citizens' assembly of 100 people, slightly different. They've got a judge who's 99 members of the public, a cross-section with a judge who's kind of running the thing. And they're looking at some pretty important things like should they change the constitution of Ireland on abortion law. So, and the results of that jury are basically fed into a parliamentary committee. So it's not that they assembly make the policy decisions. These are unelected, unaccountable people, but they can inform policy. So since the juries, various things are being produced, there's a lot of it there. We did 2 4-day juries on a separate project called Connected Health Cities. So what I guess my summary is, citizen jury is an important way to engage people, one method to engage people in data privacy, and maybe we can learn quite a lot by asking people about privacy in relation to something else, like improvements to healthcare. There's much more I could tell you, but my wife has explained to me that not everybody is as interested and fascinated in the subject as me. That's her after only 10 minutes. So I'm going to finish there. Thank you. Okay.
So for these sessions, we'll take questions at the end of the three talks. So unfortunately, the person who was going to be speaking second today was taken ill with flu, so he's not here. That's Alberto from Experian. c.i.c was very kindly agreed at very short notice to get, can we give us a very brief few words about ONS perspective on this topic.